Okay, it says my Hangout is on the air live, and I figured out how to have the chat open, I think, on another device. I just had to log in under my other account. So I just wanted to update everyone on what's going on with my situation. Because my last video, I was pretty upset. So I just wanted to gotta turn this volume down. What's going on? Okay. All right, sorry. So my last video, I explained that I have to have a third open heart surgery, that during my second surgery, I had a mitral valve replacement, and I now have a mechanical valve. That was done in April. And this is Mrs. Cat Jones. I don't know if she was in any of my other surgery videos. I think she was when I had my first open heart surgery. She was a feral cat that hi, baby kitty, that I rescued from my yard because she needed me. And she definitely has some therapeutic values and has helped me recover from both of my surgeries. I keep losing my train of thought. So I started getting short of breath again, and it ends up that my new mechanical valve is failing. Okay, it says 2 people are in the chat, but I don't know who the second person is because you didn't say hi, but I know somebody's there. All right. So my cardiologist did an echocardiogram, and sure enough, I have mitral regurgitation +3, which is moderate regurgitation. And I've also been having seizures and double vision. And I've been in and out of the hospital with that and TIAs since a month after my second open heart surgery. And so my cardiologist did an echocardiogram, and I talked about this in my last video, and I found out that my new mechanical valve is failing, and I have moderate regurgitation +3. And the neurologist saw my MRI films, and I also have brain atrophy, which is shrinkage in part of my brain, and it's the left temporal lobe and the right temporal lobe. And so I've been having some forgetfulness, and that's where my seizure activity is, and I'm having some speech issues as well. Sometimes it's slurring, sometimes I have double vision, which could be related to the seizure activity, which they're calling epilepsy. I have had the difference between seizure activity and epilepsy is when you have repeated seizures, like more than 2 a week or something, and I have several a day. I don't have the kind of seizures where you go unconscious. My seizures are just dizziness and facial twitching, like my eyelid will twitch or my cheek will twitch, or I feel dizzy, or I see like light zapping in my vision. But that's it. I'm not in pain or anything. Um, and I'm light sensitive. So LED lights, flashing lights, red lights, like tail lights on cars, strobe lights, flashing lights, sunlight going through trees, window blinds. So you see light peeking through and then a blind and then a light peeking through and then a blind, even stripes, bold white and black stripes set off my seizures. And the problem is I'm on a third different type of seizure medication, and the seizures aren't stopping. So my neurologist and my cardiologist have decided that they want to put me on disability, at least until they figure this out. If they can't figure something out, I'm going to end up on permanent disability. I'm hoping that the third medication that they just started me on will finally help. My neurologist is hoping that the brain atrophy is being caused by the seizures. So the neurologist is hoping that once he finds the right medication, the seizures will stop. And then the atrophy brain atrophy means my brain tissue is just going away in that area. And it's okay. I'm still alive. I'm not worried about it. I'm staying positive. But if he can stop the seizures, he's hoping the brain atrophy will stop. And the exciting thing is about that is your brain can find new pathways. So the forgetfulness I'm having, the exciting thing is your brain can just find a different pathway to remember things or to relearn things. So if that part of your brain is missing, your brain neurons can just grow a different way to get that back. So that's pretty cool. But the other thing is, it could be the other way around. The brain atrophy, the brain going away, could be causing the seizures. So it's important that we figure this out, which is another reason he wants to put me on temporary disability, to really focus on this instead of working and get this stuff. I almost said the S word, but I'll say stuff to get this figured out as soon as he can, because we want to halt this. And there's only so many more medications he can try to stop the seizures. I am open to trying other seizures that are not pills, as in, any medicinal marijuana or CBD oil or anything like that he wants to try. What I don't want to try, that he brought up, that I am terrified of, is brain surgery. I don't want things that cut, whether it's lasers or blades or saws, anywhere near my brain tissue. There are just too many fine nerves and vessels, and I am just scared to death. I don't want anyone cutting into my brain. I just don't. I don't think I can do that. I mean, if it's a matter of life and death, I'll have to do it, but I really don't want to do that. Hey, I got 7 people. Ruby K, you're praying for me. Thank you, Ruby K. I have 7 people in the chat, and I forgot I'm holding my phone. I am logged in as someone else so I could see the chat. And this channel has been very productive and helpful to a lot of people. So I'm not trying to be negative. I do want to keep this channel going because I started this back in 2016, and I know it's helped a lot of people. But what I've also decided to do, and I mentioned this briefly in the last video, because I might be going on disability. Well, it's definite that I'll be on temporary disability shortly. I'm having a TEE, which is a transesophageal echocardiogram, and that's where they go down your throat, go down your esophagus with an echo. Hi, Simply Mar TV. I am strong. I am woman, hear me roar. I am strong. And I'm happy. I'm grateful. I'm thankful to be alive. They fixed my heart twice. So hey, what's one more time, I'll be okay. I'll be okay. I'm just gonna go to a different surgeon this time, you know, there's the whole 3 strikes and you're out thing, and I'm saying 2 strikes and you're out, because I'm not playing, I'm not playing. So I started another channel because you never know when your life is gonna end. Which, by the way, my mom just died on the 26th or 29th. My days have been, oh, did I just stop? No, I didn't stop the chat. My mom just died, and her wake was Wednesday. Her funeral was Wednesday. Her wake and funeral was Wednesday. And I was already doing this for myself. Like, oh man, I can't put off this idea of, it's okay, Ruby. She was sick for a long time. She had multiple sclerosis. My dad died 2 years ago of dementia and ALS. He was in the military, and the government took 100% responsibility for giving my dad ALS. So I'm not happy with the military government right now. But my dad passed away, And then 2.5 years later, you know, my mom was very depressed missing him, and she was pretty much paralyzed, couldn't do anything for herself, and was starting to not even be able to hold her body up. And so she just passed away. And I just got done with my 5 days bereavement and have been going through her things and helping my sisters through that. And it just makes me even more like I just got to live my life and be happy. And I don't want to be in the hospital. So I'll go in the hospital if I have to do surgeries, but everything else I'm doing outpatient. And so what I'm doing with my other YouTube channel is, because I have to go on disability, and I because of the seizures, I can't shoot weddings anymore. I've been a wedding photographer for 13 years. And because I have light sensitive epilepsy, um, that started all of a sudden after my second open heart surgery, I had to quit shooting weddings. So I went from making anywhere from $4,000 to $6,000 a month to just teaching. So I get about 2,200 a month, to now I'm going to be on disability where I'll be getting 1,200 a month. So now where you see me now is I'm living in a tiny camper, and I'm parked in the yard of my house. I'm renting out my house, and I'm about to get a tow vehicle, and I'm going to be living out of my camper. And it's okay. I'm happy. It's not like I'm homeless. This is my home. And I used to go to RV shows with my daddy, and we always went camping. We couldn't afford an RV, so we went tent camping. And I'm just going to enjoy my life, and I'm going to travel and have fun and see things and go to warm places and never be cold and make art of the places I go to. So that YouTube channel, and I hope you'll join that channel. I hope all my subscribers on this channel will go to the other channel. And while, yes, even if you have to fly to a different state, Mayo Clinic is a good hospital. Ask for Human Veil. Human Veil. Did you say that right? Is that what you meant to say? Vale, Vale? I was thinking about going to Deborah this time, or Robert Wood Johnson Hospital. I live in New Jersey. Um, and right now, because I only work part-time, that I have I'm on Medicaid, so I'm limited as to where I can go. But I know Robert Wood Johnson is a learning hospital, and they're very good, and they take Medicaid. Um, and once if I get approved for permanent disability, I'll be on Social Security disability, and we'll have Medicare, and I can be seen anywhere in the whole United States. Simply Mar TV. What is Human Veil? The other channel, I'm in the chat. That's my other YouTube channel. If you want to click on my picture there, it's Roaming Artworks. And the website is roamingartworks.com, which just links to my YouTube page. So I see 7 people in the chat, but I'm only seeing Ruby K, myself as Roaming Artworks, and Simply Mar TV. So who's there hiding out, being all stealthy? And Simply Mar TV, what's Human Veil? The suspense is killing me. Nobody's talking to me. Is there a delay? Mrs. Cat Jones is in the camper with me. I rescued her from my backyard. And how she got her name, she was Mr. Cat. My daughter named her Mr. Cat, and it was winter. And she was out in the yard. And winter was coming fast. And his belly was big. And I was like, oh no, maybe it's a girl. Maybe she's pregnant. I better get her inside. So then I decided her name must be Mrs. Cat. And then I had a vet come to the house because there was no getting her in the car because she was very feral. But I put some food out and got it closer and closer to my door. And she came in the house, didn't you, baby girl? She came in the house and the vet said, I'm 99.9% sure she's pregnant, but let's test her stool just in case. Just she is adorable. Oh, a human heart valve. I'll tell you about that. Give me a second, because I'm pretty upset because I wanted that. Um, so he was sure she was pregnant, but tested her stool, and lo and behold, she wasn't pregnant at all. It was just worms. She was so full of worms that she appeared pregnant. So when he wrote her the script for the worm medication, the script bottle said Mrs. Cat Jones. So that sounded very jazzy and cool. So we just kept the name Mrs. Cat Jones, and that's what we call her. So I wanted to go with the pig valve. And the cardiologist said, oh, but the tissue valves only last 7 years, and you're so young, because I was 46 at the time. Was I 46? Well, the first time I had surgery, I was only 45, only 45, 44, 45. I don't know. It was 2016. I can't do math that quick. I can't even do math slowly. I really can't. So I wanted the tissue valve, and he said, oh, you're too young. If you go with the tissue valve, you're going to need surgery again in 7 years because they only last 7 years. And I said, I know, but I don't want to deal with blood clots. And he's like, oh, no, you don't have to deal with blood clots because you can test your blood. Um, you can test your blood at home. Hi, baby girl. And you just prick your finger and test your blood for clotting. Just like diabetes, you just test your blood and it'll tell you if it's the right clotness or not. And you just take a pill every day to make sure your INR levels are correct so you won't clot. And I said, okay, if you think it's safe, I'll do that. Well, they couldn't get my INR levels right. So the first time they repaired it, the second time they replaced it with the mechanical valve. And if you look through my last video of my last surgery, they never got my INR levels right. So I ended up, a few weeks after they discharged me, my INR levels were all over the place, and I ended up getting clots and TIAs and double vision. And yeah, it was bad. And I ended up buying my own INR machine to that's great that it lasted 16 years. So now that the mechanical valve's failing, I'm curious to see my TEE, because they know the valve is failing, but they don't know what's wrong. They don't know if the flap is working wrong. They don't know if how it's stitched into the valve wall is coming apart. So they they have to do the TEE to figure out what exactly is failing. There are recalls on valves sometimes, but I checked the serial number on my valve and it doesn't appear to have a recall on it. And because it's been less than a year, the surgeon I had should have to fix it for nothing, but I don't want to go back to him. He's one of the best in the nation, but I'm scared. I'm just scared. The first repair he did, he overshot the mark and put in a anaplasty ring that was too small. And then my valve was not opening properly. So I feel like the last thing I want to do is go back to him. And I'm not saying he's shady, but it's in the back of my head that, and I'm not saying he did this. In general, I'm thinking, my brain's going all over the place, and you gotta wonder, do doctors do things wrong on purpose sometimes, so you have to come back? So they have more business? Like, maybe I'm being paranoid, but it's in my head. That's cool that his valve lasted 16 years. That's really cool. I have a mechanical valve and it didn't even last 4 months, you know? Like, I should have went with the tissue valve. Really. How's the live video coming through? Is it breaking up at all or is it good? Ruby, what kind of have you had surgery? What have you had done? Or are you coming over here from my other channel? And Simply Mar TV. Did you have surgery or just your brother? And who are the other 4 mystery people? It's perfect. Good. I'm hooked to Wi-Fi. You could the shirt I almost didn't wear it to work today because it showed my scar. And some people it's funny because this is not a low cut shirt, but because that line is dark, people take a second look thinking it's cleavage. It's not. I would not be showing my cleavage in a middle school setting or any school setting. Mrs. Cat Jones right next to me. This is where she sits. I have all these Hey baby. I have all these bins next to me because I'm just moving into the camper. I have one, two, three more bins left, and I'm trying to scan all my papers to go through the bins so I don't have to have any bins in the camper. I want to be able to bring my instruments. I'm a musician, so I want to be able to bring instruments and art supplies. And I'm also going to bring all my artwork with me and my craft show tent so I can like go around the country and do craft shows. I feel ya. You have all the right to be upset. Yeah. You've had 3 heart attacks. Wow. What do they know what the cause was of the heart attack? Like my heart is overworking right now. That's why my cardiologist wants me on disability till he figures it out because my heart is overworking. My resting pulse, even on the beta blocker, my resting pulse is 100, anywhere from 100 to 107. I will get out of my car and walk to my door, and it feels like I ran a block, and I get out of breath. Tell me what a vasospasm is. Is that just a spasm of the heart muscle? It sounds serious. I've never heard of that before. I'm reading Simply Mar TV. My brother just had his pulmonary heart valve replaced recently, had it since 2003. Vasospasms in the arteries. Is that a genetic thing? Ruby K says she's had 3 heart attacks that were caused by vasospasms in the arteries. Do they give you like an anti-spasm medication to try to not have spasms? That sounds really horrible. I'm sorry you have to deal with that. See, it's things like that that like I feel so lucky. I feel so lucky that for me nothing's sudden. I have symptoms and I can get an echocardiogram and a TEE to find out what's going on. Like the TIA and double vision was sudden, but luckily it wasn't like horribly serious. And so Ruby, are you on an anti-spasm medication? Is there anything that can stop your spasms? Or does it happen all the time and sometimes they're so bad that you'll have a heart attack? I don't know if the chat is going slow on my I have the chat on my phone. There are 7 people in the chat, so there's still 4 people hanging out and not saying anything. 4 mystery guests that don't want me to know who they are. So when I'm traveling in my camper, does anybody have any suggestions on where I should go? Because I haven't really been to many places. I want to see the slot canyons in Arizona. I've been to Las Vegas to the Red Rock Canyons, and they were beautiful. I'm going to hit South Carolina to visit my nephew and his family in Beaufort. Um, During the summertime, I'll travel north and visit my sister and brother-in-law in Syracuse and my other sister in upstate New York. I take Imdur and beta blockers and amlodipine. Is that, I'm sure I'm saying amlodipine wrong, but is that an antispasm? I just started taking um, Topamax for anti-seizure, and I'm wondering if that's also an anti-spasm. It's like anti-bipolar, anti-migraine, anti-seizure. It's like anti-everything. Nitro. What's nitro? That sounds fast. Like nitrous oxide. Like, no, is that laughing gas? What am I thinking of? The button they push in the cars to make you go fast. Spring is nice in Arizona. Yeah, I missed the RTR this year because I just got my camper in December and I don't have my tow vehicle yet. I'm getting it the next couple weeks, hopefully. I'm shopping for a red or off-white Toyota 4Runner. Okay, so if you're having spasms, do your arteries tighten up and the Imdur tries to keep them open? Or do you have some kind of artery blockage as well as the spasms? Isn't the body, like, incredible? Like, just how arteries work and the job they do, and yeah. I was thinking that, I was going to ask my neurologist next time I go if it's possible that the insufficiency of my heart not working correctly, if that could be not bringing enough blood to my brain, and if that could be causing the seizures and the atrophy. Because that, this all started right after my last surgery. I've never had seizures. I've never had brain atrophy. This all started then. And my neurologist also asked if I had any head injuries recently, and I said no, but you know what? I was watching my past videos. Aw, I'm sorry, Ruby. Um, I'm sorry. Ruby has a partial blockage. Um, I was watching my past videos of when I was in the hospital, and I was talking about how I passed out. I passed out and smacked my face on the floor in the hospital. So I blacked out. So maybe I did have a concussion. And so I guess that is a head injury. And I don't think they did an MRI at the hospital. I know that they didn't do an MRI because I had pacemaker wires in. And I didn't have my first MRI till the second time I went in the hospital because I didn't know I could have an MRI because of the wires. So I'm going to bring that up to my neurologist. Is there anything they can do to clear out the blockage? A phone call just came through. It was my daughter's school. They usually say, "Hi, this is blank school district with an important message." And it's usually about a meeting. Like, I think I have like 28 voicemails from my daughter's school that I never have a chance to delete, so my voicemail's full and nobody can ever leave me messages. Hey, eighth person that just entered the chat, tell me who you are. I don't know who's here because Ruby and Simply Mar TV are the only people speaking to me right now. Make yourself known. And how long has anybody been watching my channel? All right, they'll put a stent in. My last house, not the camper and not my bungalow, but the house before that when I had my first open heart surgery, my neighbor Wilbur, um, he was 96 when I moved in there, and he actually had a stent put in, and then his stent got blocked. And the doctors at Deborah in New Jersey, which is a renowned learning hospital, they decided to try a brand new procedure, and he was the very first patient they tried this on. They put a stent balloon thing within his blocked stent, and that he was the first one they did that to. He was a guinea pig, and it worked. And I thought that was pretty cool, and he was excited to tell me about that. He was very lonely and liked company. I'm just reading the comments. Yes, it could be your heart. My brother started to get back pain and shoulder, and now it's starting to fade a bit. It's crazy how organs can affect other parts of the body. Ruby's been following me for a while. Yeah, isn't that cool about the stent? That's why I want to go to a learning hospital. That's why I want to go to a learning hospital. They try new things and they know the latest things. And like when my mom got multiple sclerosis, I was in 12th grade. I'm 47 now. So I was 17 when I graduated. So that was 30 years ago. 30 years ago, she was diagnosed with multiple sclerosis. At that time, they were just figuring out that bee sting therapy, for some reason, was making people's MS go away. It ends up being something about the bee pollen. But what they would do is they would take tweezers, pick up a bee, and put the bee on the person so the bee would sting the person. And I said, Mom, you got to ask your doctor about this. It's like making people's MS go away. And she's like, oh, no, I don't know what the long-term effects are of people getting stung by bees. And if my doctor thought it was something that would work, he would have already brought it up with me. And she wouldn't ask him. And she never tried it. And her MS just, I don't know if that's why, but her MS just kept getting worse and worse and worse. She had something called chronic progressive MS, which was the worst kind of MS you could have. Anytime she got sick, it would get worse and not get better. And she would just go downhill, downhill, downhill. And for the people that just came on, she ended up passing away just last week. Chad Cover, been following you for a while. I had my open heart surgery May 3rd. That was my mom's wedding anniversary. To repair my mitral valve, was looking up information about it, and that's how I found you. Well, I'm glad you found me. I'm about to have my third open heart surgery, Chad. My third open heart surgery because my mechanical valve is failing. I wish I did the tissue valve because I know that lasts at least 7 years, and I know I wouldn't have clots and TIAs and double vision and strokes and all the crap I'm dealing with now. I'm not happy. I'm not happy. I'm happy I'm alive, but I'm not happy about all these procedures. And the update on this video, if you just joined me, as I'm going to be going on disability because now I'm having brain atrophy and seizures and just not having a good time. And I'm just trying to stay positive, and now I'm traveling. So my other YouTube channel is Roaming Artworks. The website is roamingartworks.com, and I'm just going to travel as much as I can. I'm not going to go into the hospital. I'm going to do everything I can outpatient so I could just live my life. live my life and go places and make art, and then just go into the hospital when I have to have surgeries. I had to stop wedding photography because I have light sensitive seizure activity, and my neurologist thinks it's not safe for me to be in a classroom full time. So I have a part-time job, but now I'm even having issues part-time. And my resting pulse is 100 to 107. So um my cardiologist brain fart. Mrs. Cat Jones's ears popping in the screen. My cardiologist wants me to just relax and not overwork my heart till we know what's going on, because I have +3 regurgitation again. So I'm awaiting my TEE to find out exactly what the dealio is. The dealio. Can you tell I grew up in the 80s? All right. So I think I'm gonna log off and do my dishes here. Does anyone have any questions for me before I log off? Please subscribe to my other channel if you're watching this, Roaming Artworks. Um, I'm only going to put health updates on this channel, and all my other life and happiness and art and music updates will be on the other channel. But I will still keep doing health updates and surgery updates on this one. I'm going to give it a couple seconds in case the chat's delayed a little bit. Hi, baby girl. I love kitty cats. I love kitty cats because they need me. All right. Thanks, Ruby. I'll be looking for you, Ruby. It feels good to know that I'm helping people. Like, especially now that I'm living in the camper and I feel very alone. So making videos and knowing that I'm helping people. Nomad's 31 years old and just had mitral valve surgery 6 months ago. Nomad, did you have repair or replace? Thank you, Ruby. Oh, human valve donor lasts longer than a pig or a cow valve. That's interesting. They were able to repair. Good. Did they use an anaplasty ring? Do you know? Nomad? I had a repair in 2016 and they used the anaplasty ring. But within a year, within 10 months, I started getting short of breath again. And they did a TEE and they saw that the valve leaflets, flaps, whatever they are, were the anaplasty ring was too small. So the repair, it was too small and the flaps were not opening properly. So then in 2018 in April, they had to pull it all out and put a mechanical valve in. And now my mechanical valve is failing. So I'm having a TEE. It's actually scheduled for February 14th, Valentine's Day. How appropriate, because it's my heart. I just realized. They just scheduled it today for Valentine's Day. So I don't think I'll get results on that day, but as soon as I get the results from the TEE, or if anything happens before then, I'll do a quick update video. And when I get the results from the TEE, I'll do a live update. Okay, guys? Anything else before I hit that red stop broadcast button? It would help me if you liked this video and share it with anybody that you think might be interested. Thank you, Nomad. Thank you for subscribing. Yes, Chad. Headaches. Yes. All my life, I've had migraines all my life, but they run in my family. Um, and my son was diagnosed with Marfan syndrome, and that runs in my family. Um, so I don't know, Chad, I don't know if you get migraines, but my headaches are migraines. It's always my left eye. They start, it feels like an ice pick going in the left back of my head and out through my left eyeball. Chad, you started getting headaches 3 months after your surgery? Ah, thank you, I-58 Farms. I've been a great blessing. That makes me feel so good. That makes me feel so good. What did your cardiologist say about headaches? I'm pausing because I'm waiting for Chad's answer. Does anyone else in this chat get headaches before or after surgery? And, Chad, are you on any medications that might have a side effect of headaches? I love my Mrs. Cat Jones. Everyone should adopt a cat because they're just great. I haven't been getting migraines. Well, let me say this. I haven't been getting pain migraines, but my neurologist I'm seeing for the seizures said that some of the flashing lights I'm getting and numbness in one side of my face, he said that could be migraine, that migraines aren't always pain in the head. Cats are awesome. They are so awesome. And, dogs are nice, but it's too much responsibility. It's like, it's worse than having a kid. Not that there's something bad about having kids. I have kids. But cats, like, you can go away for a weekend and just leave them with a bowl of food. And if it's raining, you don't have to walk them because they have a litter box. um, I've always had cats. Everything will work out for me. Everything's going to work out. It might not be what I expected, but it's going to work out. All right, I'm reading. Chad Cover says, I assume there are migraines. I had a CAT scan and another heart echo, and they said everything's fine. Chad, are you on any new medications that might have headaches as a side effect? And does anyone in the chat have a YouTube channel? Like, we should all follow each other's YouTube channels. Only taking low pressor and headache medication. Is low pressor a blood pressure medication? I'm not familiar with that. My neurologist has prescribed amitriptyline. I've actually been on that since I've been 22. And that, because I would get migraines like 2 or 3 times a week. Sometimes they'd last 3 days and they would get so bad. The pain would get so bad that I would actually vomit from the pain. But once I was on amitriptyline to prevent them, if I feel them coming on, I take the rescue medication, which is Zomig. And as long as I take it, as soon as I feel the twinge of the migraine coming on, if I take that Zomig, it goes away within minutes and it never comes back. And I only get maybe one migraine every 3 months now instead of once or twice a week. Yeah, even though I have a mechanical valve, I have to take a baby aspirin. And my cardiologist the other day, I have to take a water pill because I've been retaining water. And he said, "Are you taking potassium?" And I said, "No." And he's like, "You're supposed to be taking potassium if you're taking a water pill." Oops. Yeah, Simply Mar TV's brother has a human valve. Metoprolol, I'm on that as well. I take 25 milligrams every night to slow my heart rate. So I can only imagine if I didn't take it, what my heart rate would be. Because right now it's 100 at rest. 100 at rest, my pulse. And I can't take more than 25 milligrams because then my blood pressure is too low. So I'm sorry, is low pressure metoprolol? Is that what low pressure is, Chad? Chad, how did you find out you had a mitral valve issue? And Nomad, how did you find out you had a mitral valve issue? I love her. I love her. She's so ready to go on the road with me. If you're just joining us, please make sure to click the like button. And please make sure you subscribe to my other YouTube channel, which is Roaming Artworks. I'm going to be going on disability and having a third open heart surgery. Okay, so it's the same thing. Yeah, my script actually says I kept calling it Metoprolol. Metoprolol. Putting the emphasis on the wrong syllable. Shortness of breath and chest pains. Ooh. So let me guess, you had to stop the police academy? Nomad says he knew about it as a teenager, but it wasn't getting worse. And then he had a severe leakage. Yeah, the reason I had my heart checked for the first time was my son was diagnosed with Marfan syndrome and he had a dilated aortic root. So because my cousin died from a ruptured aortic root, so I knew it was my side of the family, hereditary, and my nephew and my sister both had collapsed lungs and other symptoms. I had my heart checked, and I didn't have any symptoms yet, but that's when they found the moderate regurgitation. It was like +2, and then it was +3, and then it was +4, and I had the surgery. I'm having heart palpitations too. So right now I'm having shortness of breath, and I can hear, this is so weird because I hear my mechanical valve ticking. It's like that crocodile that swallowed the clock on Peter Pan that ticks. And I'll be laying in bed in the quiet and I hear it ticking, but I'll feel galloping, that's going way off track of the tick, tick, tick. It's like it's not an even shifting of the different chambers of the heart. It's like way off course of the metronome of the ticking. And Chad, they let you in. They let you graduated from the police academy, and then were you able to become a police officer? Like, did you have to have surgery? I'm losing track of who's who. And you're the one that had 3 months ago, you had your valve repaired, right? See, I'm also having forgetfulness issues because I have brain atrophy that just started. I'm just a mess. I'm a hot mess. Sorry about all the quiet moments. I'm just taking a moment to look at what everybody's typing. Nomad says, I'm the one that just had it 6 months ago. All right, Chad, remind me. I'm scrolling back up, Chad. When did you have your surgery? Chad started getting headaches 3 months after his surgery. That's where I'm getting the 3 months. Like, I know in the military, like, I know in the Marines, if you have a collapsed lung, you can't be in the Marines. So that's why I'm wondering if something's wrong with your heart, if you can still be a police officer. Or is that just a Marine thing? A military thing? What is a mini thoracotomy? Is that when they cut you like this and go through your sternum? Did I have it done and I don't even know what it's called? And no matter, you a boy or a girl? Because I'm gonna if this is a thoracotomy, totomy. I don't know what it's called. If they cut here and you have a scar, do people take a second look like it's cleavage? Because that's what happens to me. I chose not to become a police officer and stick to private security. Oh, yeah, May 3rd, my mom's anniversary. It's a horizontal incision on my pec and went in between my ribs. All right. The first time I had my surgery, the surgeon went this way for the repair because he said it would be easier for him because he wouldn't know until he got in there if it was going to be a repair or replace. He could go in through the ribs to repair it, but if he got in there and he ended up having to replace it, he was going to have to go here anyway. So he would just feel better going in there to begin with. So that's why he went there. So the first time it was a repair, the second time he replaced, and the third time is going to be another replacement, but I might go with the human valve. I might go with the human valve the second time around and not have to worry about blood thinners. The person whose brother has the human valve, does he have to take blood thinners beside aspirin? Like, does he have to take Coumadin all the time and worry about his INR? That's what I want to know. Mrs. Cat Jones. Nomad says, yeah, I choose to risk it and not get cracked open. My surgeon was a pro, though. Security and police officer. That must be an interesting job. I'm like addicted to watching like true crime. I like true crime, like the first 48 and like murder mysteries on YouTube. And I don't have TV or cable, so I watch like what I can on YouTube. I love those shows. I love seeing people get caught. And I love seeing how I love watching shows that show how people get away from like people that kidnap them or whatever, and you see how they got away and how they lived and survived. All right, everybody, it is 6:07 and I have to go because I have to wash my dishes. So please subscribe to my other channel because I'll be updating that one at least once or twice a week with the happiness and happy times in my life, with my artwork and music and traveling. It's roaming artworks. Thank you for joining my live chat, my live stream. Nomad and Chad and who else? Simply Mar TV and Ruby and the other 4 people who didn't want to mention who they were. I appreciate everybody listening. Oh, Ruby's still here with prayers and love. Prayers and love to you too, Ruby. Thank you. Thank you, everyone, for your support. He doesn't have to take blood thinners, just a baby aspirin. See, that's what I'm all about. I'm not about poking my finger every day. And it's not just poking your finger and checking your INR. It's when your INR is too low, you have to do a stupid head shot. You have to give yourself a shot of Lovenox, which I have a video. I put a video up of giving myself a shot of Lovenox. It's not fun. It's like someone saying, here's an axe, cut off your hand. I don't like needles. It's not easy. It's not easy. All right, Nomad. Kitty cat's right back at you. Meow. Ooh. Security at a nuclear power plant. Did I say that right? Nuclear? Nuclear. I don't know. I think I said it right. That's like double exciting. Be careful. I hope you're not like exposing yourself to like cancer stuff. Like become a security guard at like a school or something. Something that's less toxic. Thanks, Chad. Keep in touch. Comment on my videos. Keep in touch. I'll come on live again when I can, guys. All right. Talk to y'all soon. Thanks.